Welcome. My name is Dr. Clement Okonedo. I am an endocrinology student. In this video, we'll be talking about endocrine cancers, what they are, how they're diagnosed, and what treatment options are available. We understand that this can be a difficult time, and we're here to offer clear, straightforward information to support you. Let's dive in. What are endocrine cancers? Endocrine cancers are cancers that develop in the endocrine system, which is a collection of glands that produce hormones. These hormones help control vital body functions such as metabolism, mood, and growth. Endocrine cancers can affect different glands in the body, including the thyroid gland, the parathyroid glands, the adrenal glands, the pancreas, the pituitary gland, the gonads, testes in males, ovaries in females. Each of these glands produces different hormones, so the symptoms, diagnosis, and treatment may vary depending on the type of endocrine cancer. But let's start with some basics. Types of endocrine cancers. There are several types of endocrine cancers, each affecting different glands. The most common include thyroid cancer. This is the most common endocrine cancer, affecting the thyroid gland. It may cause a lump or nodule in the neck, but many cases are detected early and have excellent treatment outcomes. Adrenal cancer, a rare cancer affecting the adrenal glands, which produce hormones like adrenaline and cortisol. Symptoms might include unexplained weight loss, high blood pressure, or changes in mood. Pancreatic neuroendocrine tumors, PNETs. These are rare tumors that develop in the pancreas, which helps regulate blood sugar. Symptoms can vary widely, but patients might experience digestive issues, weight changes, or fatigue. Pituitary tumors. The pituitary gland controls many hormones, and tumors here may cause a variety of symptoms based on which hormones are affected, like changes in vision or unexplained growth spurts. Parathyroid cancer. This cancer affects the parathyroid glands, which help control calcium levels in the blood. Symptoms could include bone pain, kidney stones, or fatigue. Gonadal cancer, testicular or ovarian cancer. Gonadal cancers affect the testes in men and the ovaries in women. These glands produce important hormones like testosterone and estrogen, and cancer here can impact hormone levels and reproductive health. Symptoms might include lumps or swelling in the groin or abdomen, pain, and unexplained fatigue. Testicular cancer, in particular, is more common in younger men, and ovarian cancer is often diagnosed in women after menopause, but can affect women of all ages. Symptoms to watch for. Each type of endocrine cancer can present different symptoms, but here are some common ones to watch for. Unexplained weight changes, lumps or swelling, especially around the neck, abdomen or groin. Unexplained fatigue, changes in mood or mental clarity. Digestive issues or changes in appetite. Bone pain or fractures. Swelling or pain in the groin or lower abdomen for gonadal cancers. Of course, many of these symptoms can be linked to other conditions, so don't panic if you experience any of these. But if you notice a combination of these symptoms or they persist, it's important to speak to a doctor for further evaluation. How are endocrine cancers diagnosed? Diagnosing endocrine cancers typically involves a combination of medical history review, physical exams, and various tests. Some common tests include blood tests, to check hormone levels and other markers that could indicate cancer. Imaging, X-rays, CT scans, MRIs, and ultrasounds help doctors spot tumors. Biopsy. If a tumor is found, a small sample may be taken to confirm if it's cancerous. It's important to note that early diagnosis plays a critical role in successful treatment. So, if your doctor suspects an endocrine cancer, they will guide you through the necessary tests. Treatment options. Treatment for endocrine cancers depends on the type, stage, and location of the cancer. Here are the most common treatment options. Surgery. Many endocrine cancers can be treated with surgery to remove the tumor or affected gland. For example, thyroid cancer often requires removing part or all of the thyroid. Radiation therapy. This can be used if surgery isn't enough or if the cancer has spread to nearby areas. Chemotherapy and targeted therapy. In more advanced cases, chemotherapy or targeted therapies might be used to shrink tumors or slow their growth. Hormone therapy. Some endocrine cancers may be sensitive to hormones, and doctors may use hormone-blocking treatments to stop the cancer from growing. Watchful waiting. Some types of endocrine cancer, especially early-stage tumors, might be monitored closely without immediate treatment, depending on their behavior. Coping and support. Dealing with an endocrine cancer diagnosis can be emotionally and physically challenging. It's important to lean on your support system, whether it's family, friends, or support groups. Having a network around you can make all the difference. Additionally, consider speaking with a counselor or therapist to help manage stress, anxiety, and any other emotional challenges you might face. Remember, you are not alone in this journey. Moving forward. While an endocrine cancer diagnosis can feel overwhelming, it's important to remember that there are many treatment options available, and the outlook is often positive when caught early. Talk openly with your healthcare team about your concerns, and don't hesitate to ask questions. They are there to support you at every step. If you're looking for additional resources, be sure to check with organizations like the American Cancer Society, which offers detailed information and support networks. If you found this video helpful, don't forget to give it a thumbs up. And if you want more informative videos like this, hit that subscribe button and turn on the notifications so you never miss an update. Sharing this video with others can also help someone else who might be going through a similar experience. Together, we can spread awareness and support. Thank you for being part of this community. Thank you for watching. We hope this video helped answer some of your questions and provided some clarity. Take care of yourself, and remember, you are not alone.